Hello, my name is Natalie Geip, and I am one of the EMS sergeants at Chestnut Ridge Volunteer Fire Company. I wanted to take a second today to introduce the primary provider turn-in process and also introduce myself. I am the EMS sergeant assigned to getting you through the preceptee phase of your turn-in process, getting to your interview, and of course becoming a primary provider on 505. If you would like to reach me, I will be your primary point of contact during this process. Please use my text, phone number, or email address to contact me. If you direct message me through GroupMe, there's a very good chance I won't see it because my notifications are silenced, so please try to text or email me. My phone number and email are listed in the Chestnut Ridge Volunteer Fire Company directory on the website. If you have gotten to this phase, it means you have passed your national registry, passed EMT class, and passed your Maryland board exam. That's not easy to do, and I have full confidence you will get to become a primary provider on Ambulance 505. Okay, let's start talking about the turn-in process itself. This is your path from EMT class to becoming a turned-in EMT on Ambulance 505. I want to preface by saying Chestnut Ridge Volunteer Fire Company prides themselves on putting confident and competent EMTs on the road. This process is rigorous, but with hard work, you will not only make it to the other side, but make it to the other side very confident in your skills and abilities. Before we start, once again, my name is Sergeant Geip. I will be guiding you through this turn-in process, and I am your primary contact after you finish class and are starting to get turned in. As you have already met Lieutenant Wiener, she is amazing, and she was your primary contact when you joined and during your time through EMT class. We work in conjunction, so if you have a question, feel free to reach out to me or both of us. What is expected of you right now that you are in the primary provider turn-in process? You are entering into a job where you are taking care of people in need and providing care to people whose life could actually be on the line. This is a privilege and an honor, and it is also very serious. The patients you are taking care of deserve the best care you can give, they can get, and that means you should strive to be the best provider you can be. Imagine it is you or your family and be the person you would want to show up for them. Be on time, be prepared, have a good attitude, be teachable and interested, be helpful, and most importantly, use this time as a student to learn as much as you can. Your preceptee phase has a couple steps. The first step is your call log. This goes off the calls you complete during your time as a preceptee. This is a minimum of 10 calls, 5 of which you will lead as a team lead. So what does this mean? There's a few different roles you can take on when you're completing calls for your call log. The first role you can take on is a BLS team lead. This is where you are on a BLS shift, you run the call as the primary provider, and signing off on team lead is up to the discretion of the crew you are riding with. You can also be a team lead on an ALS shift. This is called ALS Integrated Team Lead. On an ALS shift, you can be an integrated team lead by acting in the BLS provider role on the call. This means supporting ALS with BLS skills such as vitals, patient movement, assessment when indicated, and more. Signing off as a team lead is up to the discretion of the crew you are riding with. You can also be a team member. Team member calls only count as 5 of your 10 total calls, and they are mainly for experience and gaining confidence. Then you can be in the officer seat. This means you ride up front on the way to the call, you have a radio during the call, you participate in radio transmissions on the way to the call and during the call, and you're expected to assist the driver in navigation to the call. You should be prepared before stepping into this role, study your radios, and know what to say and when to say it. Exact details on step 1, as listed in the primary provider turn-in process, are written below. Once again, you have team member calls. This can count for 5 or less of your 10 calls, and they should be marked as team member on your call log. This is where you acted as a member of the BLS or ALF team, but did not lead care and only assisted. BLS team lead calls means you've led the call as a primary provider on scene. This can count for all 10 calls and is needed for at least 3 of your 10 calls. Being a team lead on a BLS shift is the best way to gain confidence and competence in your abilities. Team lead on an ALS call means you acted as the lead BLS provider assisting ALS. This counts for up to 2 team lead calls and then begins to count as team member calls only. Riding the officer seat as listed before, where you rode up front in the ambulance in the passenger seat, operated the radio, navigated the driver, and worked with the MDT system. 2 out of your 10 calls should involve taking on this role. So your call log in the preceptee phase, again part of step 1, this is where you're writing in your 10 calls that you completed. The call log must be completed during your shift. While preceptors will be happy to help you with documentation during the shift, preceptors will not sign your call log if you come to them days after asking for information regarding the calls you ran with them. As a certified clinician, you're expected to complete respective reports during your shift or in the hours immediately following your shift. Failure to complete reports on time can lead to licensure and/or legal trouble. As we are mocking the respective reports you will complete once you are turned in provider on 505, your call log should act like a report and you should have it done on time. If your shift is very busy and you do not have a chance to meet with your preceptor for them to sign off calls, you should reach out to them that day following the shift to schedule a time for them to come in and sign your call log. This is what your call log looks like as pictured on the right of your screen. During your preceptee shifts and calls, you should be on time or early. 15 minutes early for equipment checks. You will be responsible for checking the medic, making sure everything is stocked and more. This might involve arriving more than 15 minutes early to your shift. You should be in uniform. This means EMS pants, boots, and shirt, preferably your shirt tucked in. Be ready to ask questions. How else will you learn? Make sure your questions are timed correctly. You don't want questions being asked in front of the patient that could be offensive or scary to them, and you don't want questions to interrupt the care that is being provided, but make sure you keep your questions in mind and learn as much as you can. Most importantly, have a good attitude. Be respectful to the patients and crews can choose not to ride with you again if you display disrespectful behavior. Step 2, your skills packet. This is also during the preceptees phase, and you're to be completing this at the same time that you're getting your 10 calls. The skills test or skills packet is a comprehensive checkoff of necessary skills. Skills can be signed off by any turned-in provider at Chestnut Ridge Volunteer Fire Company. You will be tested as part of your interview, so you should be very confident on the skills from this packet. Random ones will be pulled out during your interview, and you can be tested on them. Skills you perform on a call can be signed off by a turned-in EMS provider that witnessed you completing the skill. You can use skills you did on calls for part of your turn-in packet credit, or skills packet credit. The best time to work on your skills packet is during your shift, during skills labs, or during scheduled times with EMS officers. To schedule a time, please reach out to myself, and I will come in and work on skills with you. In addition, I hold hopefully monthly skills labs. They are a great chance to sign up and learn a bunch of skills together with some of your peers. The skills packet looks like this as pictured on your left. And then more on skills labs. I'm going to try and start holding monthly skills labs. So stay tuned. I will send them out and group me an email. I'm also trying to move more towards simulation-based skills labs. So you will run a call with me together and we will work on skills during that call so you get both the experience of getting the skills done and also seeing how they're used in real life. Okay, step 3 is the turn-in test. So the turn-in test is to be completed and submitted 2 days prior to your interview. When you schedule an interview, you will be given a turn-in test packet. You should complete this and email it to your respective officer before the interview. Preferably email it to Lieutenant Wiener as she will be running your interview. So the test will be given to you after you've completed your call log, skills test, and have scheduled your interview date with Lieutenant Wiener. In the email regarding the date of your interview, you will receive an attached skills turn-in test packet. This is the turn-in test we are referring to. This test should be emailed to the EMS officer at least 2 days prior to the scheduled turn-in interview. The turn-in test is an open note packet about EMS operations and assignments. You are encouraged to use your protocols, resources, peers, and other turn-in members to complete this packet. Your turn-in test answers will be reviewed and discussed during the first part of your interview, so make sure you know them well. Step 4 is the interview itself. The interview is split into 3 phases. Phase 1 is going over your turn-in test as referenced in Step 3. Phase 2 is 2 verbal or simulation-based scenarios where you run calls verbally / as you would in the field. You'll be given assessment data as you ask for it, vitals, general impression, etc. You'll have 20 minutes to complete each scenario, and you can decide to perform a consult during the scenarios, but you will be expected to do the consult as you would in real life. Finally, Phase 3 of your interview is where you will be asked to step out while officers discuss your performance. This is the time for you to take a deep breath, reflect on your performance, but know that the hard part of your interview is over. Following the 3 phases of your interview, you will be informed on whether or not you passed the interview and passed your turn-in test, critiques and learning points / things you did well, and places for improvement. Remember, you are not expected to be perfect. We want to measure your ability to think critically and perform under high-stress situations, and measure your knowledge and preparedness. So for your interview, how can you prepare for it? You can schedule a time to meet with an EMS officer for an interview study session, where you can run through verbal scenarios and review your turn-in test. Please have an interview date before scheduling an interview study session. You can practice consults and radio commands, as you will be expected to be competent in this area. Know what channels to say what on. Review protocols, medications, and skills. We are testing you on your proficiency in these areas. Finally, trust yourself. You have worked hard to get here. You know what you are doing. If you find yourself unsure of how to proceed, think critically and use what you know. Ask yourself, what would I do in real life? Not what is the right test answer. If you would like to schedule a preparation session for your interview, please reach out to me, as I am assigned your EMS sergeant for this process, and I will help you run through verbal scenarios. We can work on whatever you would like to work on before your interview itself. It's a great way to prepare before the time comes. Okay, if you passed your interview, which means you completed your call log, you completed your skills test, you completed your turn-in test, and you completed your interview, you've made it. If you have any questions at this time, please reach out to me via phone number or email. Final remarks, please reach out to your respective EMS officer to schedule shifts. I try to update the calendar once a day, so allow 24 hours for your shift request to be honored. I have to reach out to crews and clear it with them before I schedule you onto the calendar. Please reach out to me via phone number or email. I do not receive notifications from GroupMe. Direct messages will likely miss your message. In terms of scheduling, you can sign up for a maximum of 2 shifts per week. And please do not schedule more than a month in advance unless you have come to an EMS officer with special circumstances. EMS turn-in packet and call log can both be found on the CRBFC website under the Documents tab. If you have questions or concerns, please reach out. Good luck, and I believe in all of you.